This presentation, MD Economics, was created to provide information about loan repayment options to current medical school graduates. It was created by the First for Medical Education program at the AAMC. The FIRST program provides financial information, resources, services, and tools to those trying to understand the complexities of medical student debt. The AAMC is the Association of American Medical Colleges. Let's get started. So here's door number 3. It's public service loan forgiveness. In this program, if a borrower works full-time and makes loan payments for 120 months or 10 years in a qualifying public service job, then whatever loan balance remains after those 120 payments is forgiven. 120 months is of course 10 years. And another key to this program is that those 10 years do not have to be consecutive. The program is only available to those who are in the direct loans program, but you can consolidate into a direct consolidation loan if you're outside of the direct loans program right now. Also, your repayment can be on the income-based repayment terms. If your gut is telling you that this could mean a significant amount of savings, your gut is right. You may be wondering, what is a qualifying public service job? You'll need to check the regulations and/or the Department of Education guidelines, but here is an outline of what we understand as a public service job right now. It would include a nonprofit 501c3, such as a medical school or teaching hospital. That is the very entity where you're very likely to do your residency. It could also include a federal, state, local, or tribal government agency, a private organization that provides public health services, such as a community health center. It could include full-time service in the Peace Corps or AmeriCorps, and there are numerous other examples in the federal regulations. Just as in door number 1, Dr. Median, during her residency, earns between $47,000 and $58,000 a year. That makes her monthly payment starting out at about $385 and rising to about $500 in her 4th year of residency. After the residency, the repayment balance is $171,000. If you remember from door number 1, the interest then capitalized to make the repayment balance about $192,000. But here, we're going to assume that Dr. Median earns a comparatively lower salary after her residency, and this interest will not capitalize. That means that after her 4-year residency, Dr. Median will still have a repayment balance of $171,000. The $21,000 will either be forgiven or added back in once her income reaches a certain level. Here we see Dr. Median's first 6 years of practice after choosing door number 3, or public service loan forgiveness. Her starting salary after her residency is $100,000. That's roughly comparable to a beginning pediatrician in a community health center. That assumption is based on data from the 2007 report of the National Association of Community Health Centers. We grow that salary at about 3.5% per year. As you can see, Dr. Median's monthly payments will start at a little over $1,000 a month and rise to a little over $1,200 a month in her 6th year. Because she was repaying her loan during her 4-year residency and now her first 6 years of practice, she's reached the 10-year or 120-month limit of the public service loan forgiveness program. At that point, her balance will be about $158,000. And also, remember that $21,000 in interest. That interest will be forgiven as long as her monthly payment is calculated at less than $19.66 per month. As you can see from this salary and monthly payment calculations on this slide, it will be some time before her salary would reach that level. And in fact, that total will be forgiven. The next slide will show how much is forgiven. Here you can see that Dr. Median would have $180,000 forgiven after 10 years of income-based repayment in the Public Service Loan Forgiveness Program. All told, during residency and practice, Dr. Median would have made a little over $100,000 in payments, most of those after the residency. Also, you see, most of her repayment is interest that accrued during the 4 years of medical school, the 6 months of grace, and then the 10 years of income-based repayment during the residency and beyond. Obviously, if Dr. Median had a larger debt amount, even more would be forgiven.
Here is a simple diagram to help illustrate some of the factors you might consider as you evaluate the Public Service Loan Forgiveness Program. Here we see the residency length. If you were to make qualifying payments during a 7-year residency, then you would need to work just 3 years in a qualifying nonprofit and make the appropriate payments in order to reach forgiveness. So the more years in which you make payments during a residency, the fewer years after the residency that you would have to make payments in order to qualify for forgiveness. On the other axis, we see the debt amount. The program is worth considering as your debt gets higher, particularly if you anticipate working in a specialty that is lower on the MD salary scale. It makes the program even more appealing as your repayment burden would be reduced.
Congratulations if you've made it this far in the presentation. As a reward, here's one of the most valuable slides in this presentation. Here you'll see a summary of all three doors and the economic results of the choices made. I'm not going to bore you by going through each of these details, but here you'll quickly see some highlights, such as if you choose a 25-year repayment plan, you wind up with one of the lowest monthly payments, only $1,500 after residency, but the cost is the highest interest among all of these choices, over $300,000 in interest paid over the life of the repayment. You can also compare IBR to forbearance as a choice during residency. You'll see that it has a big implication on your monthly payment after the residency, but at the end of the day, door number 1 and the standard choice of door number 2 wind up with a total repayment roughly the same. Also, you'll see the highlights of the public service loan forgiveness program we were just talking about. We'll pause here a moment so that you can do your own comparisons before we move on to the next slide.